Getting ready to get started on my next patient, which is the patient with the mini screws. She saw me for consultation about 2 months ago, but she didn't decide to go for the procedure then, but now she's in a lot of pain and she wants to get it done as soon as possible. This was done in a different provider office, and instead of placing dental implants, they placed mini screws, okay? And then they were planning to put teeth on them, but they weren't able to do that because the mini screws start hurting the patient, and also they start losing bone around them, okay? So at this point, our plan is to go ahead and remove these mini screws, bone graft this area, and then later on go back 2-3 months later and place the 4 implants and do a fixed hybrid restoration for her, which she prefers. She doesn't want any removable teeth, and that's what we're going to do. To get ready for the procedure, first of all, I have to sit down with the patient, make sure they had nothing to eat or drink 8 hours before the surgery, and all the consent forms are signed. Consent basically is important before the procedure because we go over the pros and cons of the procedure, and I want to make sure the patients understand all their options before they start jumping during surgeries. So it's to inform the patient. At the same time, it's an opportunity for the patient to ask us questions to make sure everything's done accurately for them, and they understand what the recovery time is, and what the risks and complications would be, and what are the benefits of the procedure. My assistants are working behind the scene to get the room ready. Anytime the patient gets into this room, obviously they're going to be nervous. So our job is to make sure that we distract them. We talk about the essentials, but not too much about the surgery, so because they get nervous. Usually that's done at the consultation time. We're just basically chit-chatting, bring the patient in. Can you make a tight fist, like this? And start an IV so I can get the medication in so the patient can relax. Taking some blood from her because I'm going to do PRF, platelet-rich fibrin. I will spin this in a high-speed centrifuge, and then the red cells will get separated from the white cells, and then we get the plasma from the blood. Well, that minimizes infection as well as fast healing. We want to make sure the patient is fully numb. Even though they're sedated, if you don't numb them well, they're going to keep waking up in the middle of the surgery, and it's going to be a very difficult journey. So when I get to work, they're cruising nicely without any pain, and then when they wake up, they also have no pain. They're all getting inflamed and infected. Just going to remove the implants, clean the infection, and bone graft it. So later on we can come back and place the actual implants and do a fixed hybrid prosthesis. Mini implants are problems, you know, because they can break when you try to remove them. And now we have to go in and remove the rest of the mini implants from the bone. Okay? Normally the normal implants don't do that. The mini implants do, because they're very skinny. So basically multiple pieces of these mini implants broke till I finally was able to remove the entire implant from the bone. So it took a little bit longer than I expected. Once we did that, we were able to bone graft the area, and we had a primary closure with a couple running stitches of thyrochromic and Vicryl. And the patient did extremely well post-operatively, and no infection, and the tissue looked healthy. We're going to see the patient back in about 4 months to go ahead with regular dental implants and do a full lower arch fixed hybrid prosthesis. Thank you so much for watching my video. Really appreciate your time, and if you like it, please hit the like button and subscribe to our channel.